Right. 103. I think that's plenty of time for folks. Thank you all for joining us. My name is Alon Abramson. I'm the Vice President of Programs at the Philadelphia Energy Authority. I'm excited to be joined by my colleagues and partners from the Green and Healthy Homes Initiative to talk to you about Built to Last and our evaluation of our whole home repair program. Let's go to the next slide. So let's kick off with a little bit of background about who we are. The Philadelphia Energy Authority. We're a small municipal agency in the city of Philadelphia. We are essentially an economic development agency focused on energy as a vehicle for said economic development, looking at residents, at businesses, school district, and the city of Philadelphia itself as a means to kind of boost economic growth, reduce poverty, create jobs, and improve public health. So really looking at energy as that vehicle to do all those things. And the Built to Last program is really our pathway into the low-income housing space, understanding that it's a lot of work to do to get folks not just to get to the energy savings, but to get to stability and really start to do that work. And so I'm here with again with my colleagues and folks at GHHI to talk about our program, how we're approaching this, and what we found in the first few years of running this program. So let's go to the next slide. Just give you a sense of where we're going today. Give you a bit of a background on the needs here for Built to Last and our approach to doing our whole home repair, and then get right into Green Healthy Home Initiative's evaluation of our program. And then we'll leave some time at the end for Q&A. So with that, I'm excited to hand it right over to Ruth Ann Norton, the CEO or Executive Director at GHHI. Over to you.
Thank you, Alon, and to the entire Built to Last team. I have to say, I like to think of GHHI as an audacious group of individuals looking at facts and data with a soul to advance a holistic view of healthy housing, which includes not only human and structural health, but how are we doing on energy and climate and building equity, affordability, and really thinking about the three things that I think we all have an obligation to look at in our field today, which is rising cost of housing and the struggle that many people have in bridging that affordable housing gap, the rising cost of healthcare, and no doubt in part of this and foundational to this is also the rising cost of energy. And so we were going to look today in that framework. GHHI itself, for folks to know, was founded over 3 decades ago, originally to address the toxic legacy of lead and its impact on getting kids into the classroom healthy and ready to learn. Over the course of time, as we pulled the thread on issues of lead, where we were the architect and have led the efforts in Maryland and many other states across the country. In Maryland, where we have a 99% reduction in childhood lead poisoning. What we knew is we had to address those things that were triggering asthma and injury. And we looked at affordability and housing stability, which led us to energy and energy efficiency at all levels. So weatherization, electrification, decarbonization, and solar. So if you go to the next slide, where there is really common value and common vision between GHHI and Built to Last is in this idea of how do we best align, braid, coordinate dollars from federal government, from philanthropy, from local government, and the private sector to really address those housing challenges and those energy challenges that face disadvantaged communities in Philadelphia and throughout the country. And I have to say, I think when we think about those who are really excelling at this, I think today the look we took at Built to Last and in its first number of years here and the efforts that it's made, it's amongst the best in the country, and I think you'll see that. But there is a compelling need, and if you want to go to the next slide, let's talk about why Built to Last exists, the vision of those who made it come to be, and what it means for Philadelphia. Philadelphia is a real marker in this for this country in decreasing levels of homeownership as that gets out of reach for many families, the increase of housing burden, the cost of being able to maintain and own and continue in ownership that builds equity is becoming more challenging, as you can see in the slides, and where we can and need to really solidify in our work around housing, health, and energy is to be able to give people who are in lower income communities and low to moderate income communities the opportunity for home ownership, to build wealth, to build stability, so that it allows them to lift up out of poverty, to lift up out of disadvantaged communities to opportunity. This is becoming extremely challenging when you have a 65,000 unit gap on affordable housing. And that's looking at people and families that are less than 30% of AMI. Many programs that we all work in, we're looking at 80% and below of AMI. This is looking at 30%, and where we have our greatest need. That's a big gap, and what Built to Last is doing is building a framework to scale, to close and eliminate not only that gap, but things like appraisal gaps that are from a racial equity standpoint and economic equity. Let's go to the next slide that you'll see here. This actually made me stop in my tracks when I saw the dollars here. We are looking at, in a 10-year period of time, an almost tripling of the cost, 29% cost of what it means to maintain a home in Philadelphia. No doubt we're looking at the impact of post-COVID here. We're looking at shortages on contractors, tariffs, supplies, and the supply chain, all leading to this and adding to that affordability gap. And so the need to bring together, align, braid, coordinate, and leverage becomes increasingly important. And you see the gaps, the racial gaps in home ownership, but there's even wider gaps in appraisal values and access to resources amongst communities, that we also have to take a better integrated approach of bringing in dollars and leveraging those dollars to address these issues. So let's go here on the next slide. So that's housing affordability. And energy affordability, like most places in the country, bills are skyrocketing. Certainly all states that sit on the PJM, the line grid, are seeing these impacts. And there's a lot of efforts to push back requests for rates, and even to push back on gas and electric increases. But we have 19.7% of low-income Philadelphians who own homes are experiencing severe issues with energy burden. And that means they're spending more than 10% of their income just on their utility bills and the cost of keeping the lights on, and for heating, and something that is more and more critically important, the cost of cooling, as extreme heat is more focused on as a big health impact, especially in urban environments. We're seeing PECO implementing rate increases, water costs are going up. So you're seeing all of these fees happening and driving energy affordability out of reach for many people, and making the problem more complicated is aging appliances, aging electrical infrastructure in houses, and ventilation issues as houses age. There's a cost of repair in the home repair. There's a huge benefit to do it. So the driving need to bring houses up to a standard of care that can address these issues. Fundamentally, energy has so much to do not only with the utility cost, but housing stability, economic abilities of families, and also is a major player in those health costs that we see. So next slide, please. And here you got it, the health and home repair needs and costs when we're looking at over 100,000 households of low-income Philadelphians being built prior to 1960, which means there is a far greater risk of mold, mildew, and moisture intrusion, roof repair needs, and not to mention uh, lead-based paint needs. And the epidemic of asthma is especially hard hit in communities like in West Philadelphia, where you see 25% of children um, recording incidents of asthma, which means there's also a higher rate of emergency room visits and hospitalizations that are taxing not only families and families missing work because they have to care for their children who are in the hospital, the emergency room, or at home getting well instead of in the classroom, healthy and ready to learn. So it has an impact on income and opportunity and housing stabilities. But it's also a barrier in accessing the affordable resources to keep up with home repairs, especially in communities that have been disinvested in over time. And so we have to break the siloed programs, get rid of the fractionalization of programs, and be able to look holistically at what are the needs of housing, how do we bring in to solve for the structural defects, the unhealthy housing. Robert Wood Johnson's Commission on Building a Healthier America said that 40% of all hospitalizations for asthma across the country come from houses that are deficient and unhealthy. We see that an even higher rate when it's core urban centers of places like Philadelphia or Detroit or Baltimore or Pittsburgh, you see that number even higher. So this goes to the critical need and nature and the opportunity to turn that story around. But we also look at when you have these underlying problems, you have a higher rate of deferring much needed programs like weatherization assistance because you have to take care of the health and safety issues in order to weatherize a home and even further to electrify or decarbonize if you want to do that. And you can't put solar on a leaky roof. You've got to be thinking about the structural and health of housing in order to get away from the deferrals and to provide better opportunities. And Built to Last, we found, is doing a really good job of this. So let's go to the next slide here. This is my best opportunity, so I get to turn it over to Emily Lucas and to talk about Built to Last, how they're approaching it, and then we'll get into the evaluation and Q&As. So thank you, Emily, for having us today to talk about this.
Certainly, yeah. And thanks, Ruth Ann. Thanks for presenting all of that information. Alon, did you want me to announce the procedure with the Q&A?
Yes, go.
Yeah, so please do drop your questions in the comments, and yep, drop any questions into the Q&A, and then we're gonna have discussion at the end. So we look forward to talking to you all about that. All right, so I'm going to talk about Built to Last and how we operate. We are we're an owner-occupied repair program. We serve low-income households in Philadelphia, and our goal is to stabilize homes, to increase health and safety for occupants, and to decrease energy burden. Um, We are a direct service provider. We go out and we provide critical repair services. We make energy efficiency upgrades. We do some of this work. But what makes us unique is that we do that, and then we also do this other big piece. We are an administrative backbone that ties together our services with the other services that are already in the Philadelphia service ecosystem that serves low-income households with housing services. Um, so I actually really love our logo because I think it's a good illustration of how we work. So there's a bunch of housing programs in Philadelphia already doing really good work. Um, and as Ruth Ann noted, they can be siloed and it can put a burden on occupants and homeowners to need to access these different services. Um, and if you think of those like the bricks on a block wall, or in a brick wall, like our illustration here, in order to build a wall, you need to have it on a foundation you need to have it on a strong foundation. And as Ruth Ann described, sometimes service providers aren't able to deliver their services in a house that is in really bad condition. It has to be brought up to a certain level so that they can go in and provide their services. So some of what we do is to provide that foundation work. Um, the other thing that we do is that we provide some of the gaps that those different bricks, those different services don't provide. So we also try to fill the holes of what's not being provided by our partner programs. And then the other piece that a brick wall needs to come into being is somebody to assemble it. So we kind of consider ourselves this administrative backbone that's building this brick wall. There's already the pieces in the Philadelphia service ecosystem, but we're working to assemble that into something. So next slide, Maxine. Okay, so like I said, we've got really amazing service providers in Philadelphia that have been around for a while doing excellent, excellent work. Some of them are on this call today. We have repair programs, utility programs, some legal service programs, health and housing counseling services. Um, and as Ruth Ann noted, there's really deep housing need in Philadelphia. And oftentimes, a lot of homeowners their housing need is so great that they need all of these services, or they need a lot of them. And piecing together all of these services is a burden. It can be, they have to apply for these programs, they're on different timelines. And also, as Ruth Ann noted, the deferral rate can be a barrier because if you're going in and you're delivering a service, but the house is in such poor condition that you're not able to deliver the full measures that you could deliver, or maybe it's just not even at a point where you can even start. So those are the two areas that we're really trying to address. Again, with Built to Last, we're trying to make sure that homeowners have an easier time accessing services. And we also want to make sure that the service providers have an easier time delivering their services and they're able to really go in and do everything that they're able to do. Next slide. Okay, so from the homeowner perspective, this is the path that they can expect if they apply for Built to Last. So a homeowner will apply for Built to Last, and we consider this kind of a one front door model where if they're applying with us and they're bringing us their income documents and they're showing that they're homeowners, and we're checking their eligibility for our program. We also have the opportunity at that time to be helping them check for their eligibility for all of these other programs. So we work with them to help them do that all at once so that we can find out kind of from the beginning what all other services they might be eligible for. And then we work with them from there to try to access those services. So kind of a initial one front door screening. Then the next step is that we do a full property assessment and we assess the home through the needs that or the goals that I just described, stability, health and safety, and then lowering utility burden for the household. So we look at it through that lens, ask ourselves, what is it going to take to achieve those goals? And then we say, who in our network can help us? who of our partners can help us do that? And then what is an unmet need? And then that's the piece that we are funding through Built to Last directly and providing. And then we're managing that construction work. We're working with our partner programs to help them deliver their service, and then we are delivering our construction services as well. Next slide. So this is kind of that same process, only more through the management lens. So this describes a little bit more about how we do a whole home assessment. We're assessing the whole needs of the home through all of these lenses here, health and safety, energy efficiency, potential for solar, things like that. And then we're asking, again, what can our partner programs provide? And then we coordinate with them to get them to come to the table and provide those services. And then we're asking at the same time, that lower track that you see down below, what are the gaps that the partner programs can't fill that this household needs? And that is what we use to generate the scope that we pay for. We're also asking ourselves, what do the partner programs need to be able to maximize the services that they provide? So again, we're really trying to make sure that they can go in and do the full extent of what their programs do really well. And we ask ourselves, how can we support them in doing that? So this is kind of a dual track that the homeowner or that the project is going on, and that we are managing on behalf of the homeowner. So we're coordinating with all of the program partners up there at the top, and then we're working and delivering our construction services down below. And then at the end, the homeowner has received a comprehensive suite of services. All right, next slide. All right, so in terms of our suites of services, there is not a one-size-fits-all model. We meet each house and each household where they are at, and we try to move them as far towards a better situation as we can. So first, we know that we always want to address health and safety needs. We want to address any environmental hazards. We want to make sure the building shell of the house is stable. We want to make sure that the house has basic systems that are operational, functioning heat, electric, HVAC, plumbing. Make sure that's all taken care of. We know that's foundational to building out any of these other things. Once we've taken care of that, we ask ourselves, what's it going to take for this house to be stable 5 years from now? So we do a little preservation thinking. We also think about, now we're kind of in this middle yellow block. We ask about occupant health and safety, aging in place, indoor air quality. How can we really set this house and household up for success into the future? Then we ask ourselves, after we've taken care of those things, what's it going to take to get this house to maximum energy efficiency? And this is where we get into our air sealing, weatherization, high efficiency equipment, electrification, and solar. We often have opportunities to do these pieces before this point. If we're replacing an old boiler that is no longer in use, we're addressing our red block, but we can achieve a green block by doing that, by upgrading that equipment at that point. So we work along a continuum. All right, next slide. Okay, this is a really exciting slide. It's a great visualization of how we stack and layer our services. So these are 4 different Built to Last homes. And the blue block at the bottom, that is Built to Last. That's what we've paid for directly. And then the other colorful blocks in this graphic, these are the other services that we're able to bring in and layer on top of that Built to Last investment to get to a big comprehensive project. So it's a great illustration of how far the partnership can go when we are layering services. The far right bar, Smedley Street, great example of some stacked services. It's a big project. But the thing I want to call out about this one is that this project started with our partner, Basic Systems Repair, and the house was in such poor condition that it wasn't going to pencil out for them. They were pretty concerned that they were going to need to defer this house. So they reached out to us and they said, hey, can we work on this together? We said, absolutely. And so we got together with the collaborative, all the partners, and we looked at if we each did our piece, if this project could go from being unviable to viable. So we were able to do that. We were able to take this house from being in pretty poor condition and not eligible for services to being eligible for all of our services when we work together. So we're just, again, proud of the way that the collaborative can work to solve that deferral issue that Ruth Ann talked about. All right, next slide. This is just a quick illustration of some of our work to reduce energy burden for households. These are the same 4 houses that we were just looking at a moment ago with the capital stack. The dark green bars are the pre-intervention utility costs per year. The yellow is the post-intervention, and then the light green is the cost after solar is incorporated. Smedley Street, we didn't do a lot of energy efficiency work, but they have a lot of savings. And that I just want to note, sometimes just basic critical repair work is energy efficiency work and can have a big impact on the cost for the household. Okay, next slide. I'm going to end with a few photos. So this is an example of a boiler that had aged out of its useful life, and we were able to replace it with heat pump mini splits. So the homeowner is getting heating and cooling. Next slide. All right, we replaced a roof, and when we did that roof replacement, we were also able to introduce solar. Next slide. All right, this is an example of there were some interior plumbing leaks that had caused a lot of interior damage. Not only were we able to do the repairs to the plumbing, but we were able to do some of the other work to restore the interior finish. All right, so that's Built to Last in a nutshell. I'm going to hand it off to Wynn, who is going to talk about the impact of our program and the evaluation that GHHI did. Thanks for your time.
Thanks so much, Emily. And we're really excited, as Ruth Ann said, to present this evaluation of the Built to Last program. So you now have background on the need, the Built to Last model. And, as at GHHI, Ruth Ann mentioned, we were founded over 3 decades ago, focused on lead. But we've developed this our whole house approach to home repair in the years since, conducted over 50 feasibility and evaluation studies just over the last decade. And it's, with that expertise and experience, we bring to this evaluation showing the Built to Last has built and implemented a program that is really effective and poised to scale further. And so just to get into some of the numbers here with my colleague Brendan, we're going to kind of co-present our evaluation results and then have time for questions. This evaluation period that we're looking at was between January 2023 and October of 2025. So within that period, we're looking at 340 homes that were served with Built to Last with nearly $12 million in construction costs. I'll go more into depth into all these results, but the 3 themes we want to hit on through this evaluation are, one, showing this whole home model in action with Built to Last addressing 5 critical systems on average per home and layering nearly 3 funding sources per home. Energy affordability, you've heard how critical that crisis is, showing that the vast majority of Built to Last respondents either maintaining or improving affordability of energy bills, and then also improving health outcomes. So if we can go to the next slide, I'll walk you through the methods. I'll be pretty brief here to get into the real data, but just wanted to emphasize that this evaluation is looking at both the direct program data from Built to Last, as well as survey data. And there were some previous surveys Built to Last had conducted, and then GHHI last year, in partnership with Built to Last, circulated another survey which received nearly 70 responses. The program data, as you see, there's slightly different sample sizes based on data availability. So we're just taking the maximum data availability for each variable. I won't go too long on this. I'll start to get into the results of the evaluation with the next slide. So first, we're looking at the program reach and the population that Built to Last is serving. So like we said, this was across 340 homes. So you see 623 residents, including 161 children. Of the households with children, that's nearly 2 children per home. A few things we want to highlight here. So one is, we talked about the affordability challenges. So 95% of the household receiving services from Built to Last qualify as either extremely or very low income. So that's under 50% of area median income. So that's again highlighting the households that have really the least amount of money to spend on these critical repairs, showing that Built to Last is meeting these needs. One other thing I wanted to highlight is 51% of the primary contact who is in touch with Built to Last over the age of 65. And that's actually about triple the citywide rate in Philadelphia of senior citizens. Senior citizens in particular can be at risk for household health hazards, especially trip and fall hazards, other hazards in the home. So this is, I think a strong result of reaching not just a vulnerable health population, but also, making sure that seniors can stay in their homes from a, financial maintenance displacement perspective. And, we see Built to Last really effectively reaching a population of high need. So we can go to the next slide. So in our survey, the GHI circulated, we asked the participants of Built to Last, what were the barriers that you are facing in trying to get these repairs to your home? And number one, far and away, as you can see here, was affordability or cost. Nearly all respondents listed that. You see the top few barriers listed, and I should say this was a multiple answer question. So, participants could select multiple answers. You see the first few are economic or financial, underscoring the importance of that. But you also see a good bit of answers around the process, the complexity, also finding contractors. And, each respondent to the survey listed an average of 2 barriers, per household. So really just wanted to highlight the compounding needs, the affordability challenge that's faced, but it's not just affordability, it's also coordinating, reaching, and receiving these services. So underscoring it's both we need funding and also the coordination of those services, like Built to Last is doing, are key. So we can go to the next slide. All right, so now I'm showing you data that comes directly from the assessment records from Built to Last. And so this is data on the hazards and housing quality issues that were found in the homes. And as you can see here, there are the number one, trip and fall hazards. As I mentioned earlier, the population, being disproportionately a lot of senior citizens, this is really, really critical that you see, so many trip and fall hazards found in homes. Then, window leaks, roof leaks, plumbing leaks. Again, those, sources of moisture are not just a concern for mold or for indoor air quality issues, but are also exactly the types of conditions that might defer a household from, weatherization, energy efficiency, other types of repair programs. And I'll just mention that, the prevalence of hazards here, first of all, you see households with many, compounding hazards. So it's not just one issue, it's multiple issues. And second of all, the prevalence among the housing stock in Built to Last is really much higher than, studies of the overall sort of typical housing stock or just the overall housing stock in Philadelphia. So for example, you see the leaks data here is all around, 46, 47, 48%. The prevalence overall in the housing stock is more like 16%. So that's like 3 times higher prevalence in Built to Last, the households that Built to Last is serving. And kind of across the board, you can see, looking through this data, that the homes really with the highest need are the ones that Built to Last is serving and is able to coordinate these services. We can go to the next slide. So with that context, it's really remarkable that Built to Last has a deferral rate of only 1% due to housing conditions. And we've mentioned earlier, these deferrals, particularly for weatherization, energy efficiency programs, there can be a wide range. A previous study of Pennsylvania weatherization assistance programs found the average statewide rate was 36%. We've seen, anywhere from 10 to 50, sometimes even over 50%. And typically it's the homes that are, most in need of these resources that are deferred due to a leak in the roof or other, structural issues. So given the high level of need in the houses that Built to Last is serving, the fact of only having 1% deferral rate is really tremendous. And it's made possible by Built to Last, partnering and layering in these external funding sources, doing this align, braid, and coordinate model that we've talked about throughout this presentation, and showing that this is really the way to connect households that need comprehensive, wide-ranging services, home repair services, with those and being able to comprehensively address those needs. Go to the next slide. So data on this slide is taken from the scopes of work data from Built to Last. And what we really want to highlight is that Built to Last is addressing, on average, 5 critical building systems in each home. And when I say critical building system, it's really each one of these line items here. So, carpentry, roofing, and building envelope, plumbing repair, asthma trigger control, etc. Built to Last is addressing on average 5 in each home. And that is really the whole house model in action. It's meeting, these homes as we've seen and shown with the data that have a number of cross-cutting issues. It's demonstrating, an ability to meet all those issues. And so the most common system addressed is structural work, nearly 90%. But as you can see in the percentages here, plumbing repair, 78%, roofing repair over 50%, building envelope over 50%, as well as addressing energy performance, energy efficiency, health and safety. And so again, this is really exciting and I think promising to show the whole house system in action. I will now pass it over to Brendan, my colleague, for the next slide to walk you through the rest of the evaluation.
Yeah, and thank you, Wen, and thank you, Ruth Ann. It was a great. I'm Brendan Brown, the Director of Research, Green and Healthy Homes Initiative. It's a great pleasure working with Alon and Emily and to do this evaluation. The next 6 slides I'm going to present. The first 2 are kind of about the funding and the cost, and then we'll talk a little bit about the benefits that we were able to using the post-intervention surveys that we conducted. So as you can, Wynn was just showing, talking about the complexity and of the repair needs for the homes and how we had addressed, like on average 5 critical system repairs per home. So this was done by, success by Philadelphia Energy Authority, successfully leveraging about 2.7 funding sources per project. And again, as you can see here, that was about 62% of that came from Built to Last direct funding, as Emily presented, and that is kind of great slides on the stacking of the different case studies. And about 38% came from funding other partner sources. So that's the layering of funding. And this kind of leverage rate equals about 62 cents of partner funds leveraged into each project on average for every dollar spent of Built to Last funds. And the Built to Last funds are critical because they're the flexible funding that allows you to do all the work that siloed programs wouldn't be able to do. And in this manner, Built to Last simplifies access to funding from a wide range of external home repair and energy upgrade partners and funding sources. And without the layered funding provided by the Built to Last program, these low-income homeowners in Philadelphia would be faced with the risk of displacement or not being able to meet, utility cost or mortgage cost. And then what happens is they defer the maintenance on their homes, and this is why you have all these kind of built-up maintenance costs. But without the Built to Last programs, they wouldn't be able to afford these repairs, nor would they be able to, in a lot of cases, access the multiple housing programs needed to address all the different complexity of the home repair needs. So next slide, please. And as I was saying in the last slide, a lot of these homes had very expensive home repair needs. And here you can see that the average cost per home was about $34,000. The median cost was around a little over $30,000. And you can see the distribution and the cost on the right. Over 85% had costs of $20,000 or more. Kind of the highest cost category was that middle cost between $20,000 and $30,000. About 34% of the homes fell in that range. But again, even above that, 30,000 or more was over half the houses, right? Needed that type of investment. And again, you have to think these are senior citizens, families with children, families with, disabled persons living in the home. and the median income was under $20,000. So any repairs of this magnitude and complexity is not going to be able to be accomplished by the homeowner alone. So again, this is one of the successes of the Built to Last program, because again, if we were talking about the 50% of seniors trying to age in place in their home, the alternative is assisted living facilities. And in Philadelphia, that ranges in cost per year alone of around $77,000 to $100,000. So again, this is it seems like a significant investment, but if the alternatives are worse, right? There's not affordable alternatives. So next slide, please. So the next 4 slides, so that was kind of the program cost. It comes from that survey that we did that Wen mentioned earlier. Essentially, we sent out, or Philadelphia Energy Authority sent out 352 emails with a client survey question post-intervention to those who hadn't been previously surveyed in some of the other survey done earlier. In the 36, there was 36 questions in the survey, which covered questions on housing affordability, energy affordability, health, and client experience with the program. These were distributed and filled out between December of last year. We had about 66, or a rate of about 19% answering. So the next few slides will be on those survey results. So you can see this one of the first things, like we said, that was a great outcome for the program is that 94% of the participants said that the energy affordability either stayed the same or improved. And this is really notable. The 43% that said it improved, that's obviously great, but also the 40% that reported no difference. This is not like a neutral it's actually a positive, because this is the same year where utility costs went up by 10% in Philadelphia. So for someone to say that they're not experiencing any differences, that's a net positive. So the other thing I'd like to say here is that the responses on the energy bill, show that this was affordable, but there was still a number of the in the same survey who still rely on energy bill assistance. So this is something that will help them over the long term. Next slide. And for overall satisfaction, we looked at here in this slide, you could see that there was 83% of the survey respondents said they would recommend the program to friends or family. This is always a great result. Also, 76% of the survey respondents were satisfied with the intake and coordination process. Similar numbers for the construction process. I think it was 73%. These are all favorable in comparison to other kind of general rating of federal kind of government services. Usually fall around 60-70% range. So that was very a good sign that the program was enjoyed by the clients. Next slide. And so this slide's about a little bit about the health improvements. And overall, we asked about general kind of physical health, and 88% of the participants responded that they had a improvement in their physical health after the intervention. But specifically, which is great, because this has to do with like the thermal comfort and the improvements in the home. One measure that was kind of related to that overall general physical health is the improvement in sleep, which we list here. There was 53% said they had improved sleep, and this kind of thing shows that it's kind of a good sign of reduction in chronic stress, and this can be related to thermal comfort or indoor air quality improvements from the intervention. Also, like Ruth Ann had mentioned earlier in the presentation, that there's a lot of these families with children or even adults have respiratory problems or asthma or COPD, as indicated in some of the program data. From the previous CHOP survey that was done, they showed a 48% improvement in health outcomes. It was another small sample, but again, these types of improvements can lead to big benefits. For every dollar invested, you can get returns of $5 to $14. I said here, looking at kind of the health and the social outcomes. So there was also, again, 51% of the population being seniors. There was a lot of fall prevention work done besides structural work, like improvements to the entry and stairs in the homes, these type of things to prevent falls. So on that, I will go to the next slide, which is, this is kind of to end out the final evaluation report. We have a series of recommendations. Here's three of the main ones. There was more in the report, but the first one is really that we think this the Build to Last program has the potential to scale. It's already proven that it can scale, use the economies of scope to do more work more efficiently. We have a good idea with this evaluation of the cost of the program, and the type of work and coordination that needs to be done to reduce participant burdens, to improve efficiencies, right? That 1% deferral is great, right? That's, you're really getting the dollars to the interventions, right, to help people. But here, just as an example, we have if you wanted to do 10,000 homes, right, to try to help people stay in their homes in Philadelphia, that would cost around $333 million in total construction cost. And now, again, if you're thinking about the layered funding, about 2/3 of that would have to come from Built to Last funding, and then again, 1/3 of that coming from partner funders as well. Another policy recommendation is to support this type to help operationalize and scale the whole home programs. We have an example of federal legislation that passed the Senate, the 21st Century Road to Housing Act, which includes the previous separate Whole Home Repair Act, which is actually based off the Pennsylvania state level program that helps to fund the Built to Last program. We also think that state and local government funding can also help to invest in this type of upstream housing preservation work. And third recommendation here is to, again, looking for additional funding sources, because there's a lot of benefits that accrue outside of the energy sector, such as the health sector, as well as like social services and criminal justice sector, but specifically around healthcare. Getting healthcare investment into these type of whole house programs is essential. One example we have, or possibility in Pennsylvania, is that you can use Medicaid 1115 waiver funding to do home modifications. GHHI helps with partners at the Penn Medicine Lancaster General Health. They've invested $50 million to do lead prevention work and do whole house work in Lancaster. And that's to do 2,800 houses in 10 years. So similar kind of funding by healthcare partners could be replicated in Philadelphia to help this great program, Built to Last program, go to scale. And so I want to stop and hand it over to Alon to moderate the questions here. And thank you.
Thanks, Brendan, and Wynn, and Ruth Ann, and Emily as well. We should hear from the participants themselves, but because you are all muted in webinar mode, I'm gonna queue up some questions that I've taken from the Q&A. So thank you all. First up, I wanted to talk about our backlog. I know waitlist management has been a big challenge for us and a big topic. Emily, I think this is going to be for you. There are just some questions about the logistics here, so I wanted to get into those first. So how do we, first question is, do we have a backlog? And then the question is, I think these are related, are we able to triage and place everyone who's referred to us? And then similarly, how does this one front door kind of approach look when there are multiple intake points? People can enter through other partners. So I think kind of all of that maybe is a discussion on one front door as a pivot.
Yeah, I think I can answer in a few different ways. So we do factor in time on wait list as a heavy factor, but we don't use that as our only determining factor on how quickly we serve people. Um, I think we can talk about one front door in a second, but one thing that we really do want to make sure that we are doing is helping with deferral avoidance with our partners. So we want to make sure that we're also serving people that are coming up through our partners' programs and they're going in and they're seeing a need and they're going, we can't move forward but for some help. And then they let us know. So we always want to make sure that we have a path there. And we are looking to try to build out, try to gather a little bit more information about the folks on our wait list so that we can be a little bit more thoughtful and strategic about how we move forward. The city has developed a digital one front door where folks can go in and apply. It's an amazing tool. They can fill out a screening tool about their house and their household and their needs. And that screening tool will help them get automatically signed up for some different programs, which is great. The benefit there for us is that once we have folks who are coming to us through that program or through that door, they'll already be on wait lists for other programs, which is helpful for us. And it also lets us know a little bit more about the characteristic of the house and the need, so that we can more appropriately help match it with maybe some funding opportunities that we have. Yeah.
Okay. Next question, I think, is maybe going to be a no for us, but I really want to hear from GHHI, which is, does Built to Last have a single evaluation template for evaluating the property holistically? Is that something we can share? So Emily, if you want to talk about our side, and then I really want to give it over to GHHI to talk about their experience too. You're muted.
Can you repeat the question? That was the single intake or the single evaluation?
If there's a single evaluation template for home evaluation.
No. But I think that some of the feedback that we've gotten from our evaluation partners is that this is kind of a next step in the program, is to be developing a more standardized evaluation on the front end and the back end so we can be doing better benchmarking. Yeah.
I think sort of best practice is that quality assurance, quality control back end of not only the work done, but the tracking that can be done on, you're doing that on energy savings, but also on the health surveys and impacts. And we can get to it in a minute, but I think the big upside for funding is around so many important things, right? You have a really compelling case for healthcare funders, for people on mental health and housing stability. But I do think the single evaluation on quality assurance, quality control, outcomes where there are cost savings, whether kids are getting to school, parents getting to work, housing stability, appraisal gaps, all of these things that can come together are great on a single shop basis, for how dollars are spent and where they're going and where you're seeing the highest outcomes. But it is really the cumulative data that will drive things for Philadelphia. But I think you're well on your way to be able to do that.
And I just wanted to, go ahead.
Oh, I was just going to add to what Ruth Ann said, like with data and evaluation, especially with the whole house program, like the Built to Last program, it really requires a lot of deep engagement with those partners, right? To make sure you're getting like the quality data, the quality data, that you're getting standardized data. And I think that, Philadelphia Energy Authority has made a lot of progress in that direction, right? They're trying to centralize and standardize their data, but, again, it takes kind of constant technical assistance on their end and kind of training of the local partners to make sure everyone's, looking at things the same way and recording it the same way. So, go ahead, Emily. Sorry.
Oh, I wanted to say we do have a home assessment form that's standardized. But I think the question was
That's right.
beyond that.
That's a little different than the back
Yeah,
end,
yeah.
right? But it is the basis for which you're judging against, and that so not a big leap to get that advanced, I think.
Um, okay. Well, there's a question sort of following up on our sort of application wait list management, and that is what the average time is from application to service delivery. I think we can probably talk about that two different ways: how long our wait list takes, and then how long from somebody being pulled off the wait list and then being sort of served, and what our normal project timeline is.
Sure. Yeah. So I think we're serving folks who have been on the wait list since kind of the end of 2023. So we're looking at a few years at this point, into 2024. Our wait list is growing significantly. So that's still the condition is that it is a several year wait list at this point. Obviously we're trying to, we're trying to scale and grow so that that is not the case. In terms of wait, once we get through intake, we're targeting around 4 to 6 months. Usually intake can take a little bit. It's really client driven because it's a matter of getting documentation in. That can happen pretty quickly in a matter of weeks, or it can sometimes it takes over a month or two to get all that taken care of. Then we'll do a home assessment and develop a work scope. That's probably about 2 months. And then from the beginning of construction through the end is 2 to 3 months.
We are at 1:59. I want to do one more question if folks don't mind staying on. And this one is kind of highlighting some of the not 100% satisfied feedback. There's a question on from the folks who didn't give like a full-throated 100%. What were reasons they might have been dissatisfied? Were any of those kind of consistent reasons? And has any of that critique had an impact on the program?
GHHI folks, did you collect any of that? I think that you had
Yeah.
some of that. Yeah.
Yeah, we did some there were some we presented some of the survey findings, but there was also open-ended questions. And I'll say there was the small percentage that were, dissatisfied or very dissatisfied. Um Interestingly enough, a lot of their comments even would match some of the comments given by those who were very satisfied or satisfied. But it was often around maybe more case management, more kind of housing navigation services, because some of the people were going through multiple, as we said, 4 or 5 different types of repairs. So kind of knowing what's going to actually happen in the end is like a process, right? It's not a, even so I think that was, I thought, very interesting that you got people who were very satisfied and very dissatisfied saying the same thing, right? And if you ask Emily and Alon, they would most probably say some of those things are definitely needed, and especially if you want to scale, you're going to need kind of more that, like we said, more housing navigation and case management to help with lower the participant burden, and then you'll also need more of that deep engagement with the partners, right, to make sure everyone's kind of has the same messaging and is doing the kind of like can communicate, right. It's really around communication, be able to communicate the process to the person, and manage expectations,
Yeah, I
which
think this is something just in programs around the country, the big need that if there are, funders who are thinking about how do they take this to the next level of success, funding case management navigators, funding the post remediation education so that you keep the success moving on housing maintenance and what people can do. And then I started to say this at the top of these Q&A, Alon, is, on the healthcare side, where I think Pennsylvania and I think Philadelphia can be could really benefit is from a children's health insurance program, SPA agreement, unused CHIP dollars that can be put back into this process that can help with some of the case management, the education, as well as interventions. That's a big opportunity sitting for Pennsylvania. in addition to Medicaid managed care support, right? If you look at community health needs assessment, the number one thing that hospitals managed care get and request is housing, asthma, and energy, right? Lead falls down a little bit on that list in that grouping too. But energy is such a big one, and housing stability. So there are funding possibilities to give even greater support. But what we also find in evaluations like this is you do a great job addressing the critical needs and the health needs and the energy needs. So you get to those, you triage up to those big needs. But there's other things that people would like that just aren't funded for. And I always try to tell people we're not doing bamboo floors and somatic cabinets and different things, but we're going to get you healthy, safe, stable, right, in these types of programs. So you raise, I think you're getting to people's wants a little bit in that, and the need for funding to help round out the process people who can support the human beings in this better, as well as the structural side. So I think there's big opportunities for funders to come in and support such a good program here.
Well said. Okay, well, thank you all for attending, and for those who were able to stay a few minutes extra, and the JHI team and PEA folks. Yeah, we have some slides. There was a request to share those out. I don't see any problem with doing so, so we'll work on getting those out to you. And yeah, stay tuned. We have a lot of work that's going on. We've just received funding from the city through their home initiative. So program is still going. This is just an initial evaluation. We're hoping to continue to work with JHI in the future as well. And so, yeah, just let us know if you have questions. We're super excited about this work and talking about it. So we hope we can support other municipalities in doing the same.
Yeah, and great work by Built to Last. People should understand that this is really a phenomenal need in major cities around the country, and you all are stepping up to do that. So thank you for letting us be a part of the look and the partnership. Thank you.
Thanks so much.